Nawal-Al-Maghafi has been there on and off all through the year, doing some absolutely phenomenal, heroic journalism. You've just come back now, haven't you? What have you seen?
So I went a couple of months ago and we worked on a film about the humanitarian situation in Yemen, and I was lucky enough to be able to go again, and unfortunately the situation is only getting worse. I walked around Sana'a and I was really upset to see people begging outside restaurants, and people that are well dressed, so you can see that it's people who weren't in need before, and it's a really depressing situation.
And what about the situation in the hospitals? When you and I were there together in July, it was terrible actually.
Yeah, I think there's more hospitals now that have closed down. The health system in Yemen was already on the brink before the war. So now it's only gone so much worse. And when you see some of the main hospitals in the capital city having to close down because of the influx of people that are coming in, and then just not having the equipment, not having the medicines to take care of these people, so they're forced to close down, it's really heartbreaking.
Oxfam, I know, is doing amazing things. Tell us what you're up to.
So yeah, Oxfam's been present in Yemen since the escalation of the fighting last year in March, and we've established programme locations in the north and the south. We have 150 national staff who go out in all the conditions, under severe stress, under lots and lots of family issues, supporting their own people. The resilience of the Yemen people is phenomenal, and what they're going through right now is horrific. And we here in the UK should do everything we can through organisations like Oxfam to support them. We provide fresh water, we provide food vouchers, we provide support in winter kits, which are scarves, blankets, coats, because winter's coming right now and it's very, very cold out there, and people don't have
People
access.
don't think of Yemen as getting cold. It's very high up.
Very, very cold.
Yeah, because it's so high up,
Exactly,
isn't it?
yeah.
Mountains.
Yeah.
And with the electricity system and all the public services in disarray, there's a big reliance now on solar panels when they work, but basically with the lack of fuel, lack of access to firewood and everything like that, then it's going to be a very tough winter for those people out there.
We got a question from Patricia Wiskarek. She wants to know, it's a very good question, it's a deadly good question actually. Will every penny go to the poor people of the Yemen?
We've literally just spent the last couple of weeks working out our strategy of how to help the people more effectively, how we can get the most out of the money that you donate to make sure that it is accountable, to make sure that it goes to the right people, and make sure that it does make a difference.
I mean, you can see I've travelled just recently now, we travelled to the far north, and we travelled also to the other side, and I visited IDP camps all along the way. Some of the IDP camps are the ones that Oxfam is facilitating, and you can see that the aid agencies are bending over backwards to do the best they can to help these people, but unfortunately they're just not funded enough.
In terms of the hunger, and the kind of, people are talking now about approaching famine. So from the beginning of the year to the end of the year, you've constantly been going back. How much worse has that got?
When we went to, when I went last time and we were focused mainly on the hunger, I think we went to hospitals that were facilitated by some of the NGOs. And the further we went out, the worse the situation got. So, I really hope that an appeal like this means they'll be able to meet more homes, they'll be able to help more people, because the need is so high. And what breaks my heart is seeing children that are really struggling, that are starving to death. A third of Yemen's children now are going to have stunted growth. So it makes you think.
One third of Yemen's children have stunted growth.
Are severely malnourished. So you think, what does that mean for Yemen's future if we're not providing to help the children of Yemen to have a proper childhood, to go to school, to be fed properly?
Tell me how much difficulty you're having getting that aid.
So it's really difficult working in Yemen. There's only one flight into the country, into Sana'a, and then we have to...
And that only goes about, what?
3 times a week, and it's a very small plane, and it's facilitated by the UN. Then we have to wait for some time to get a travel permit. Then
sometimes it stops altogether, doesn't it?
Yes.
As you know that, don't you, Nawal? You were stranded there during the fighting. Back in the 2 months.
But once you've got there, then you have to apply for travel permits, and you move around, and then the infrastructure is broken, and then you have to go through checkpoints, and then you have to reach to where you want to give your aid and support to, and you need to facilitate with all the local people to make sure you're giving it to the right people.
A question from Anu. How are you coordinating the work on the ground between the various agencies to avoid duplication of effort? That's a
So that's
cracker of a
it's a
question,
very,
yeah.
very good question. Of course, agencies, we have different sources of money, we have different expertise, and we bring it all together. So Oxfam deals with water and sanitation and hygiene issues. It deals with providing food vouchers. And then other agencies are looking at nutrition. Other agencies are working in the hospitals, as Nawal said, and we work through the UN. We have a cluster system. So we facilitate that through then to make sure that we're in the governorates that need the support. We're working as a
How
synergised
many
front.
these provinces or governorates, as you call them, are there?
Oxfam are working in 4 main governorates.
About
at the moment.
17, aren't there?
22,
22,
in total, yes. And so aid agencies are working in the south and the north. You know, we have an imperative that we work where the need is.
Tell us what's going on in the south. It just sounds awful, where that awful suicide bombs have been going off.
So I didn't go far south, but the situation is getting a lot worse in the south as well because there's complete lawlessness on the ground. At the same time, I think one thing that's universal all over Yemen is that people have had their salaries cut, which means the people that were middle class, that at least had money coming in on a monthly basis to feed their children, now have no salary.
So there's 7 million people who are really in need of aid, and there's 7 million people who are reliant on those government salaries and have not been paid for the last 3 to 4 months. So basically, if the situation doesn't improve and we're not able to support them, then we could look at 14 million people that desperately need our help.
So what you're having now is, on top of everything else, on top of the blockade, on top of the bombing, you're now getting economic and financial collapse, is what you're saying in the big
And it's heartbreaking. It's heartbreaking to see children who were at school yesterday not able to afford to stay in school. They have to go in the streets and beg because their parents are out of work. It's really a sad situation.
You've also got the 3 million people, like basically the population of Wales, that have fled their homes because of the safety and security fears. They've left their livelihoods behind. They don't have any sources of income. They've carried whatever they have on their back. They've gone and stayed like we would with friends, relatives, and where they haven't got people to stay with, they're in government buildings, disused government buildings, or these informal camps. They have no income. They can't go to the shop and get credit. They can't do that, and they're just so reliant on the support that you give.
And there's a question here from Sheila. Does the money get through quickly enough to help those people who are in imminent throes of starvation and death?
Yes, it does, because we can do it through cash transfers. What we're finding is that people basically don't have any funds. They can't go to the shop. And so we have this scheme where you're able to give them a certain amount that meets the household food requirements. They can go and then spend that in the shops. It keeps the local economy ticking over. A bit like you going to your corner shop. If that corner shop suddenly folds, where do you go? You have to go further and further afield. We need to keep that economy ticking over at the local level, so you can go down to your local shop. She keeps buying things in. It keeps the economy ticking over. We can get cash distributed very, very quickly, food vouchers distributed very, very quickly.
Shane said in the beginning that Yemenis are very resilient, and I think one of the reasons that we haven't seen a proper famine-like situation in Yemen is because people rely on each other when they're in need. But now everyone needs help. That when you knock on your neighbour's house to ask for food like you once used to, unfortunately they're having to close their doors because they can't afford food themselves. The situation in Yemen isn't that there isn't any food. There is food, there's food in shops, but you see people sitting outside that are starving, that simply can't afford it. And simple things like cash transfers that are being done are life-saving because it means these people that are in desperate need to feed their children can tomorrow go to the shops and buy the food.
It's worth bearing in mind, just was saying, of course, that not everybody watching this will know that Nawal is Yemeni. She was brought up in the Yemen. So when she says people can't give away to their neighbour, you know, you brought up in this very compassionate public culture where you looked after your neighbours, and that is just people still want to do it, they can't. You're saying?
Yeah, it's very difficult. I mean, I saw people huddled around in some of the villages we went to, huddled around sharing one big piece of bread with their neighbours, with whoever they could, just because everyone was in need.
And with the sanitation deteriorating as well, when we've had a recent outbreak of cholera that we've had to respond to.
Where did the cholera happen?
Happened in several governorates throughout the country, and it's an indicator that the situation is getting worse, and we have to respond, and we had to respond very, very quickly.
I think I didn't realise how bad the situation was until we were in that hospital and we met the little boy Shuaib, who just had diarrhea and fever, and all he needed was a simple antibiotic that his parents couldn't afford to buy for him. And then we were standing there, and an hour later, he passed away in that hospital.
I know, I watched
and it really brings it to home when you think, my siblings had fever and diarrhea last week, and my parents went to Boots or to the nearest pharmacy and got them their medicine. And being a parent and watching your child pass away like that, and not being able to provide something so simple, really brings it to home how important it is to help the people.
Nawal's reporting has brought home a lot of these terrible stories. And that's the sort of thing which through the Oxfam and the other aid agencies, we can't stop it, but you can mitigate it. Lots of people are dying. Don't forget that. What we're learning tonight, lots of people are dying in this crisis already.
But we can take part in helping save a lot more people.
And we can save more lives. So, like I said earlier, we truck water to where it's needed, but at the same time, we're building water networks to hook these people in. We're providing water trucking we call it water trucking, just big trucks of water just arriving at your door to schools and to some of these government buildings, to these camps. And 4 months later, 50, 60 of those are hooked into a network. We're effectively using your money, and then we can move on to the next ones and to the next ones. And we're supporting what infrastructure is there to sustain those. So it's not just like we do it and we run away. We try and make sure that it can sustain itself in these situations.
Yeah. I mean, what is happening here, isn't it, Nawal, that the big powers around Yemen are sponsoring one side or another. The big international powers are doing the same. And the overwhelming majority of the 27 million people of Yemen are victims of this.
27 million people that are paying the price for the fighting that's going on. And what we can do is save them and help them. And it's really important that we do. One of the boys that we met was Abdurrahman, and he was dying because he was lactose intolerant. And he really needed life-saving milk that his mum couldn't afford to buy for him. And when we gave him that milk and we saw him drinking it and we thought we saved a life, it was unbelievable. And the idea that everyone now can do that, everyone can help save a life in Yemen, is overwhelming. And I really hope that people pick up their phones and do that, because it's one of the best things in life, knowing that you took part in saving a child or in giving them a future.
We hear about these people who are living under temporary shelters. You're providing some clean water to them. You're providing ways and means to buy food. Otherwise, they have nothing to wake up in the morning. What am I going to do? Where am I going to go? Do I return back to where I came from because this is horrific? Or is that going to be more horrific? They don't know what to do. So if you can provide anything, it gives someone something to cling to, that things can get better, things can improve, and there is some hope for them.
Thank you very much for coming on, Nawal. Thank you very much.
Thank you, Peter.
Yeah.
Thank you.